Hey YouTube, today I'm going to talk about FFS surgery and how that went. It didn't go too well, sadly, but you know, I watch all these videos on YouTube about girls getting their FFS surgery and they look amazing, and I'm so jealous, and I wish that mine went amazing too, but all I can say is if you're getting surgery, I hope yours goes amazing. And yeah, because no one should feel like their surgery went wrong. It's a horrible feeling. And I can tell you, if you have like dysphoria before getting surgery, the dysphoria after having surgery go wrong is like 100 times worse than whatever you had before. So I do wish it goes well, and I'm not going to tell you to go see a doctor, to not go see a doctor. I'm just going to tell you my experience, and you know, that's what it is. So you know, I really wanted to get surgery like for the feminization part. Like, I felt I looked pretty good before surgery. And I'll be honest, like, I work in a business with so many gorgeous women. There's so many gorgeous women in my business, and every year it just seems like more and more gorgeous women come into my business. And I've worked in that business for so long, right? And I've always been really confident, pretty confident, but just as many just as many gorgeous women there are in the business that I'm in, there are also a lot of bullies and nasty people. And I can tell you, after a while, my confidence just kind of went downhill. And it shouldn't have, because looking back at it, I look pretty good and there was no real issues. It's just my confidence is not really that great. So I was looking for something just to boost it back up. And I thought, okay, I'm going to get this surgery and it'll help me feel a little bit better. That's about it. So I thought, looking back at it, I should have just left everything alone. I should have just left everything alone, done nothing, and I would have been better off. And I'm not sure if that is because I picked this doctor or it was just the surgery in general. I do not know, but we'll talk about that later, like what the issues are. And I don't know if I'm going to drag this video out or if anybody's even going to watch it, but I feel good posting it. And so I decided to get surgery, and I said I'm going to pay whatever it takes and find the best doctor, alright? Because if you don't know, here in Toronto, there's like so many doctors that promise a whole bunch of stuff, and at the time, 2017, there was not really anyone skilled enough to be doing these kinds of surgeries. Now there is one person, but back then there really wasn't, that I knew of, okay? And so I said, I'm going to fly wherever it takes, wherever it is, pay whatever it takes to get this done right, because I've had so many bad surgery experiences in Toronto that I'm not gonna let anyone do that to my face, alright? And if you look at my botched breast implant video or my laser hair removal video, you know I've been through a bunch of stuff. So I was not gonna let anyone do that to my face. So I said, whatever it takes. And I consulted with everyone from Mexico to Spain, Argentina, Korea, Belgium, Boston, Minnesota, Illinois, California, like in Toronto, so like everywhere that I could, and did my research. And it took months, and then I finally came across a doctor on YouTube, Dr. Keojampa, and I came across this video and I was like, this is different. This doctor doesn't have a fancy edited video. He's just there in the OR room with a jaw, and he's talking about something technical. And I was like, I like this because I'm a technical person, and it just seemed kind of down to earth, just the way he was talking, and it wasn't all polished or nothing like that, and I like that. So I called his office and I said, can I have a consultation? In 2017, his wait times for consultation, it was like 3 weeks or 2 weeks, and I have a consultation. He didn't have much on Instagram. There was no like patients posting before and afters, except one, I think, from Arizona. I think so. And but not much. And so I booked a consultation through Skype, and talked to him through Skype, and we talked, and it was very impressive. And if you are a technical person, you know when you talk to another technical person, it's just a different kind of feeling, okay? And I talked to so many surgeons, and you either have two kinds of surgeons. One is you ask them questions and they will say, you'll get the feeling like you're asking too many questions, like you're hassling them, right? Other ones are like, they will say, don't worry, you'll be fine. Yes, they're just like yes to everything. Yes, 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 and you'll be fine, you'll be all okay, right? And basically those are like the two you're gonna run into. So it's very different talking to this Dr. Keojampa, because he could answer any question. You could ask him 100 questions and he could answer every single one and tell you every kind of detail, why he's going to do this, how he's going to do this, with what instrument he's going to use. Like, he loves to talk about that stuff. And I think when you're passionate about something, you love talking about it, like with other people. Like, you love, it's not a hassle to talk about it. And I think he's very passionate about doing surgery. Like, he loves what he does, so he doesn't mind educating you about what he's gonna do and why. And it's not a hassle. And it's very rare to find surgeons like that, to be honest, who are that open and want their patients, not even their patients, just want people to be educated. And I think he knows that the other doctors are not like that. So if he can be like that, he'll connect with you and he's got you as a patient. So it was a very nice consult, and he's easygoing, down to earth. He comes off as like a regular guy, not like some snooty surgeon, and I liked that. All right. And so we talked about the forehead, the lower face, the neck, the Adam's apple, the lip lift. And I said a couple of things. I said, do not make my face sag. I've seen so many girls get these jaw shaves and their face sags, and they have no more, they have this kind of look to their lower face. And I said, do not do that to me. I want it to be tight, and I want my neck line. Do not make my face sag or make me look older, alright? And that is really important to me. The second thing is, I seen enough flat foreheads that I don't want a flat forehead. I want like a nice round forehead that goes into my nose, right? Like that S shape, like that. And I said, don't make it flat. In Toronto, there's a bunch of doctors that can do these trachea shaves, and they all do the same thing. They put the scar on the right over the Adam's apple, like where they're gonna shave. And I could get that surgery here, paid in Canadian dollars, and just get it over with. But I don't want that scar there, because if you looked at my laser hair removal video, I've had some very extreme issues with scars, and I'm like, why would I put another scar if I don't have to, right? He said he could hide the scar. He'll hide it under my chin. And I'm like, awesome, right? He's skilled enough to do that. So we talk about that. We talk about the lip lift. We talk about the jaw. And we talk about V-line and mini V-line. We talk about all these things. And then I'm so impressed with this doctor during the consultation that I end up booking the consultation, booking the surgery, like not far off after the Skype consult. I booked the surgery. I call the office and I say, I want to book the surgery. Can I put my deposit down? And this office, it's been through some changes. I paid the deposit. I want you to understand, like, I'm paying Canadian dollars, so it's like 5,000 US, but it's like 7K Canadian dollars, right? And as soon as I put the deposit down, the planner, she is very rude to me. She's very rude to me because I say, I'm putting deposit down, but I like to book another consultation to ask the doctor some questions. And she says, either you want the surgery or you don't want the surgery. The doctor only allows one consultation. And I was like blown away because I just put the deposit down. The money is locked in there, and she's telling me I can't have another consultation. What? And so I was so upset, and I've dealt with so many rude plastic surgeon staff that I was thinking, I had such a great consultation with this doctor. This staff member doesn't represent the doctor. He's not like this. So I thought, okay, I'm just going to stick it out. And I never got a chance to have another consultation during the whole period of booking the date to surgery, which ended up being like a year. All right, a little more than a year. I had only talked to him one time during the initial Skype consult. So I get the surgery date. There's like some delay on my part, and surgery ends up being a year out. And it comes time to go for surgery, and I booked the LA location because I was a little familiar with LA. I was not familiar with San Francisco, to be honest. I never been there, and just the area where the surgeries were, I just did not know anything about it. And when you're having surgery, it's like kind of the last place you want to be is a tourist, is like right after surgery. And if you have no idea where you are or where stuff is, it's like very difficult. LA, I knew a little bit, so I felt more comfortable, and they had the aftercare center there, Serenity, and so I thought, okay, I'm gonna go for LA, and I can use the aftercare center for a couple of days, then go back to my hotel. So we book LA, and it's time to fly there to LA for surgery, and I end up I have no one to come with me, and I don't want to bring my parents, and I ended up bringing a friend who doesn't travel, go on vacations or any of that, and I say, you want to come to LA? And she's so excited, and I book all her stuff for LA, and we go to LA, and the thing with her is she has no experience with surgeries or blood or any of that kind of stuff, so I was not sure how she would be around all that kind of stuff. She ended up being awesome, but you know, we get there, and the first place I stayed at was at the Marina del Rey. All right, like okay, surgery's on Wednesday, pre-op's on Tuesday, I land on the previous Sunday. So Sunday, Monday, pre-op, then surgery. So I land, we go to Marina del Rey, and the hotels there are kind of, honestly, it's not that great. Marina del Rey, I didn't think it was worth staying there. It's kind of overpriced. Some of the hotels were sketchy. I made a video about that Hilton Garden Inn. It was kind of lame, so I wasn't really into it. I had to walk through the bar to get to my room, and I was not gonna, like, so I was like, no thank you. And so and the room was tiny, so I was like, we went to Santa Monica, and Santa Monica turned out way better. Same prices, but the rooms were huge, and they were right by the beach. Marina del Rey, you gotta walk quite a bit to get to the beach, and it's, I think is Venice Beach, that area. The Santa Monica area is just a nicer place, if like touristy place. So anyways, go to Santa Monica, get the hotel there, and it was a nicer room, bigger room, and I was worried about my friend. I was more worried about my friend than I was worried about me, because I didn't want her to feel like she's trapped for like 2 weeks with someone who is like recovering from surgery. I wanted her to go out, explore, have fun, and she's just, you know, if I need any help, she can help me. If anything goes wrong with surgery, she can like communicate with my parents, but I didn't want her to feel like she's just there for me. So I ended up, so that turned out great, the hotel near the beach, and I made a video about that too. So anyways, get the hotel, then Tuesday is pre-op, okay? And I hope I'm not dragging this out. There's so many details. So Tuesday is pre-op, and I go to pre-op in his office, and it's at Marina del Rey, and it's a huge, like, office building. Go up to his office, and the radiologist takes me into the CT scan, does the CT scans, and I can recommend, like, if you're doing the CT scan, make sure they put the lead apron on you, and if you want, you can ask for the thyroid guard. I asked for it. They had it hanging on the wall, but I don't think they usually give that out, but I asked for it, because why not protect your thyroid from any kind of radiation. So we did a CT scan, and then the nurse takes me into exam room, and I am so excited to meet this doctor. I have not really talked to him in like a year or more, and he's never met me in person, and so I'm nervous and everything. So I'm there, and he doesn't show up. The nurse pulls out a monitor, and he comes up on Skype, and so he comes up on Skype, and I am so upset. Like, I'm flying in from another country. There's so much on my mind, and the doctor is not there to meet me, alright? And so I cannot express how upset I was at that moment. It's just, I was like, what have I got myself into? This doctor could not be bothered to meet me. And I've never had a surgery like this. So do I even matter? Like, is this doctor, does he care? What is wrong? Have I done something wrong? Like, I don't know why this doctor's not here, right? And so I was really sad, and we talk a bit. He sees the CT scans on, he has access to that, and then I leave. And I want you to remember this, I'm leaving, and they just don't say anything, and no one gives me any forms, any pain prescriptions, anything like that. I leave, I go back to hotel. Surgery is the next morning, alright? I go back to hotel, and next morning I wake up and I go to the surgery center. And if you don't know, his surgery center is it's like his office, and then the office next to it is this, they've converted it into like a private OR, like and little recovery area OR, and it's not a different building, it's just like the offices next to his office have been like converted to a OR, so operating room. And I can vouch for it, it's a legit operating room, and it has everything you would find in other operating rooms. So it's not a hospital, but it is a legit surgery center. So that is his. I don't know if it's his or he shares it with other doctors. I don't know, but that's what it is there. So I'm in the waiting room, and the nurse brings out this stack of forms, and I'm going to tell you, it is tacky, unprofessional, just horrible practice to throw forms at the patient right before they're going to change into a gown, alright? I've come from another country. I have thousands of dollars invested, from the surgery deposit to the hotels to the flights. So much money involved, right? If I don't sign these forms, I might not get the surgery. These forms should have been emailed to me weeks ahead, so I have time to read them and decide if I want to sign or not sign, alright? I have like basically no option but to sign them in that moment. What if I can't read? Like, what if I'm there and I can't read and I have nobody to help me? Like, it's just the practice is not right. And most surgeons would send you forms way before surgery time. So it didn't make any sense. They gave me the forms, and what I didn't notice, they didn't give me any pain prescription to give to my friend. So just remember that, okay? So I change into the gown and I go in and I'm on the bed and I'm ready to meet the doctor. Doctor's not there. Nurse is ready to put the IV in me, and she puts the IV here, and I've had so many IVs, they usually put it somewhere on your forearm, but she went straight here, and this is the worst place to put an IV. I don't understand why they go there. I've actually never seen anyone do it like that. And usually if they lose access here, they go for here, but I don't know why she went straight there, but she put it there, and my arm started to kind of balloon almost, and it was like she missed the vein, so she had to take it out, do it again, and the same issue started happening, so she turned it off, and I'm sitting on the bed waiting for the doctor. Doctor's still not there. It's been like half hour since I changed into the gown, got IV. Now she brings me another form to sign off on the procedures. So it says forehead, the lower face stuff, the lip lift, the neck, and I sign off on everything except for the lip lift. He's not there to explain to me how he's going to do the scar. Like, is it going to go in my nostrils? Is it going to flare my nostrils? Is it going to make my nostrils crooked? I've had 2 alar reductions. Am I going to have to redo them? Like, he's not there to explain anything. And so I'm like, I can't sign off on this, but he's not there. So I sign off on everything else. And I say no lip lift. And then what happens is he just comes like 15 minutes before surgery, or 10 minutes, something like very short. I meet him. I'm so happy to meet him, and I'm like, this doctor, he's here, he's gonna take care of me, and everything's gonna be okay. And we take pictures, and I go into the OR. Alright, so I go into the OR, but nobody goes out to my friend in the waiting area to tell her I've gone into surgery. She's waiting there forever. She has to knock on the door while I'm in surgery. Then they have to come out, give her the pain prescriptions, because we didn't get any pain prescription before, and painkiller prescription, and it was just unorganized. So I was already out in surgery, and then she goes off, and she's gonna meet me later at Serenity aftercare. So surgery's over. I wake up, and we're waiting for the Serenity aftercare car to come pick me up. The car does not come for, I think it was hours, alright? And I'm gonna tell you, I underestimated how much pain this lower face work gives off. If you've had wisdom teeth out and it was very painful, then you're probably going to feel a lot of pain in your lower face. If you had wisdom teeth out and it didn't hurt much, maybe you won't really feel too much pain. I felt incredible pain. It was like kind of overwhelming how much pain there was, and it was just kind of like non-stop throbbing of pain. And I'm waiting for this Serenity aftercare car to come pick me up. It's not coming. Finally they come. I get in the car, and somewhere between the surgery center and the aftercare place, I get lost. The car gets lost. It gets stuck in traffic. I don't know what happened. I black out. There's no painkillers involved. And apparently it took hours between the surgery center to getting to the aftercare place. It took a long time. And I get to the aftercare, Serenity aftercare, and I've had no painkiller since the surgery, since leaving the surgery center. No painkiller. It's like 7 in the evening now. Alright? I'm in the bed. They bring the Percocet painkiller to try to swallow, and when I try to take the water, it just shoots up. Like I just throw it all up. And so I can't take this painkiller. We tried to dissolve it in the water just to like swallow it, but I can't swallow the water. It just like, I'm gagging and just reflexing it, the water out. Alright? And I went from 7 in the from the surgery center to 7 in the evening to 1 a.m. No painkiller, no Tylenol, no nothing. Alright? And honestly, I think those nurses were traumatized because I was in so much pain. No one knew what to do. Serenity is definitely not equipped to take care of any kind of issues or emergencies, and I'm not blaming them or anything like that. But it just seemed like this was a real emergency where I couldn't get the painkiller down, and they weren't sure what to do. So what happened was 1 a.m. comes in, a prescription for Demerol comes in, and Demerol is injectable, so they come in and they inject me in one arm. Like an hour or 2 hours later or something, they inject in the other arm, then in one thigh, and then the other thigh, and it just went on like that. And I really needed that because the pain had got out of control, and I just was not sure how to handle it. And there's no way, if I had just gone straight back to a hotel, I would have been able to manage this. So it turned out for the best that I picked LA with the aftercare center there, and even though they were kind of slow on everything, it just turned out for the best. And I ended up staying there for a couple of days because it kind of got out of my control, like just managing everything. I was kind of overwhelmed, and I just said, let me just stay a couple of days, and I did, and they were great. All right. So that was that. And then what happened is 2 weeks later, I go get the staples out, or it's like maybe 10 days or something. I go get the staples out, and I go home to Toronto. So I fly home, and when I get home, I'm really swollen, so it's really hard to tell what is right or wrong. And the first thing I notice is that the trachea scar is way too low, right? And remember, I flew to this doctor because he has that skill to hide the trachea scar. Or I could have just got that surgery done here. And I email him, and he, you know, this is when the conversation, like the communication kind of starts to break down, because the scar is obviously way too low, and he just says it will heal higher. He says the way he makes an incision, it will heal invisible. all this kind of stuff, right? The fact is, there should be no visible incision on the neck. It's either in the crease or under the chin or something like that. There should be like no like incision line there, and I don't understand why it's there. So, you know, right away I can tell he's just telling me stuff to kind of make me whatever happy or something like that, and it's nonsense. It's nonsense. It's way too low. That's just the fact of it. All right, and I don't know why it's way too low. I don't know if there was obviously some error, but all he has to tell me is that there's some mistake. It shouldn't be too low. I'm sorry, something like that, but don't treat me like an idiot and tell me it will heal higher or any of that kind of stuff, because it shouldn't be there. All right, and so I could just tell like this was not gonna go very well. The second thing that started to pop up was that I noticed my chin was round, and I didn't understand why my chin was round. After talking so much with him about V-line and mini V-line and all that kind of stuff. Actually, in Serenity, I had started to draw my chin because I thought it's gonna look like this once the swelling goes away, but it didn't. It ended up not looking like that. It's like he just did some weird chin shaving or something, and I don't know what he was doing really. The third thing that started to pop up was that I had no shape in my lower face. I had serious sagging in my lower face, and actually, like, it's so strange because it's not just here, but like your whole face from your cheeks down start to sag and droop, and one of my requests to him was like, do not make me look older, alright? And we talked about sagging and all this kind of stuff, and this kind of sagging and issues here, he kept saying it's just swelling, it will go away. It's very common in these surgeries. There's a lot of swelling, it's true, but if you start to see sagging and your cheeks drooping and this kind of stuff, that stuff's not going away. That's not swelling. It's because like your bone has been removed and your face is just drooping, all right? And this is exactly what I talked to him and told him I didn't want to happen, and I couldn't believe that I was looking in the mirror seeing this very thing happen that I told him, please don't make happen. Don't make my face sag. Don't give me this like soft kind of weird jawline. And I said, please don't do that. And it was happening. So and then I started to have like marionette lines around my mouth. Everything was falling forward. It was looking horrible. And so I could not believe this, right? And so I told him, like, I was in constant communication with this doctor, and I will give it to him. He's very open with his communication. It just seemed like when I'm talking to him, it's kind of like excuses, alright? It's not really like, he knows I'm upset, but he's not like admitting anything is wrong. He's just saying it's swelling, it looks fine, it looks normal, it looks to, you know, it's just that it all looks good. So That was like the second issue that started to come up. All right, this whole lower face looked horrible. Then the third issue was, I had told him so many times, do not make my forehead flat. Please do not make my forehead flat. And not only did he make my forehead flat, he made it so flat that it is lower in the middle than in around the orbitals. It's lower in the middle. Like, if you watched the last video, I was watching that and I was thinking, my God, it is so low here. There's a shadow right here. And I can run my finger right across into the type 3, back over, like it just goes like that. And I don't understand. This is only from shaving too much in the middle, and I don't understand what he did that for. It makes absolutely no sense. It's not feminizing. It looks horrible. And it's so hard to explain, right? It's so hard to explain. And this lighting, actually, it looks half, it actually looks okay in this lighting. I just have to carry this lighting wherever I go and it'll be okay. But that is the case. And I explained to him, it looks like my orbitals, like why do my orbitals, they don't look any different than before surgery. And I don't even know how to explain that to you, because he did do something on the CT scan, but it doesn't look any different. So it's not loose skin. I don't have loose skin over my eyes, and tightening that area up won't make any big difference. Like, it's clear, it just doesn't look like the orbitals are shaved enough. So I don't know what to say about that. So I was just upset about everything, from the trachea to this weird chin jaw shave to this flat forehead. It should not look like that. And I can understand if you're going for this and you have like no expectations, you just want to get rid of your brow bone, you don't care, then I guess you'd be happy with that. But I went to this doctor with expectations, and I told him exactly, I can't be more clear. I told him exactly what I was hoping for, and it just, I don't know. Like, I don't know what to do with this. Do I put filler in my forehead? I don't know what to do with my jaw, because if you look at this CT scan, one side is different from the other side. So I don't know what to do with that. And like here, there's the hook from the angle. Here, it just goes straight. So I don't know what to do. Like, you can see it. It's embarrassing, and it's not quality work. So I don't know what to do with the chin. Now, do I have to cut this open again to have the chin done properly? Like, it doesn't make any sense. Why go through that twice, all that pain, for basically having to redo it again? Makes no sense at all. And I'm gonna be honest, there's no way I can walk into the women's washroom unless I'm wearing a crap load of makeup. So it just looks like that bad. All right, and the sunglasses kind of fix everything, but it just looks that bad. And now I don't know what to say, right? And my communication with him was always very, like constant communication. It just seemed like he didn't really want to help or do anything. Like, he's not very understanding, alright? And I don't want to tell you that because I'm the one who picked him. Like, I've told you so much good stuff about this doctor in this video, right? And I'm the one who picked him. It's not like somebody told me to go to him. I'm the one who picked him, and I see all these good qualities in this doctor, but it just seemed like he kind of brushed me off and ignored me, and it just seemed like this work is half-assed. And how can I tell you anything good about this doctor when it just seems like he didn't respect me enough to even like hide a freaking trachea shave scar? It doesn't make any sense, and it's upsetting. And I can tell you, like, these transgender surgeries, my nose is getting blocked up for some reason. I hope it's not forest fire smoke, but these transgender surgeries, they've always, like, I don't know what I'm doing wrong. It's just like half-assed stuff on me, and I'm picking the best people. I'm spending a ton of money, like this ridiculous amount of money, and I'm getting like low quality work, or work where people just don't care to do a good job. It's like they don't even see the point of doing the surgery well, alright? And now I don't know what to do, honestly. I don't know what to do. Now, some girls are going to say, well, you need to get a facelift, alright? This is after getting a facelift. Those girls don't know what the hell they're talking about, okay? Most of these facelift before and afters are not on people who've had their jaw shaved and had that strip removed, okay? These gorgeous before and after facelifts are people who still have that little flare on the edge of their jaw, not where it's shaved flat like this, okay? After shaving that flare off, your jaw is gonna look, it's just gonna look soft and crappy. So I'm not saying yours is gonna look crappy, I just feel like mine looks crappy. So I don't know, I'm getting upset, and I don't know what to do. So I hope, so I don't know. I'm going to make another video just about CT scans, why you should get your CT scan. A lot of people, no one on YouTube has done that, so I'm going to do a video like that, and maybe it's helpful, maybe not. I don't know, but I'll just make a video. So I wish the surgery could be better. I wish it, I don't know.